In the words of the prophet Usher Raymond, if I got to tell it, then I got to tell it all. And that's exactly what I'm doing today. I'm telling it all because sometimes in cardiology, you have to have some tough conversations with your patients. And that's exactly what happened to me not very long ago when I saw a 20-something-year-old in the office for a consult following a hospital visit after some less than smart recreational choices that caused him to have some cardiac symptoms, a little bit of elevation in cardiac enzymes, and because of this decision, could have very well cost him his life. On today's episode of Make It Make Sense Cardiology, we're going to talk about just a few of the ways that cocaine affects the heart. Student nurses, new graduate nurses, pull up a chair, please. Find something to write on because you're going to get a pathophysiology lesson in this class also. For those of you who I've not had the pleasure of meeting, my name is Andrea Gibson. I am a cardiac nurse practitioner, educator, and creator of what you see right here. Make It Make Sense Cardiology, because brilliant nurses will sometimes get frustrated and even intimidated by cardiology simply because physiology hasn't been explained as clearly as it ought to, and then you end up learning some things that just go in one ear and out the other, which causes you to kind of miss some clinical nuggets. And I can't have that. Not on my watch. I am here to change that. So that said, let us learn. 20-some-odd-year-old patient comes in to see me, again, following an ER visit after what he describes as a wild weekend, full with a bunch of adult decisions that we won't name specifically, but he was very open and candid with me about one particular decision he made, and that was trying cocaine for the first time. After he did so, he said he started feeling this burning in his chest, this pain that was just indescribable, scared the you-know-what out of him. He went to the emergency room because he thought, this is it, this is how I'm going out. Emergency room workup, fortunately, was negative as far as the heart is concerned. Now, mind you, his troponin was a little bit elevated, just a hair over what normal parameters are. And this is a high sensitivity troponin, incidentally. But nonetheless, general cardiac workup was negative. They told him still follow up with cardiology because of the implications that this particular substance can have on the body. Let's talk about it. Let's unpack it. Cocaine is not just a stimulant. It is not just a stimulant when it comes to the heart. Does a world of things. Let's unpack. Understanding what cocaine does to the body, first you got to understand what the sympathetic nervous system is to the body. The sympathetic nervous system, this is the part of the nervous system that is responsible for the majority of communication and action to function for a lot of the processes in the body that we don't have to actively think about. You don't have to actively tell your heart when to beat. You don't have to actively tell your lungs when to inhale, when to exhale. You don't have to actively tell your digestive system, hey, there's food in there, go to work. You don't have to actively do that. Sympathetic nervous system takes care of all of that for you. When this sympathetic nervous system is excited, and I mean dramatically excited, which is one of the things cocaine can do because cocaine is a stimulant, right? Sympathetic nervous system gets overstimulated as it relates to the cardiovascular system. You are going to have a lot of things happen. Let's talk about just a handful of them because I'm not going to drag this out with a geek out session that I already feel like is in process, and I'm trying to suppress it as we speak. Number one, when the sympathetic nervous system is overstimulated as it relates to the heart rate is going to go up significantly. We're not talking 10 or 15 beats or so, like it's going to get up there. When that happens, what is also happening at the same time with the cardiovascular system is that the arteries are the blood vessels that take blood from the heart and carry it to other places in the body. The arteries will actually begin to constrict. They're not going to slam shut, but they are going to tighten significantly. This then increases what is called systemic vascular resistance. The heart now has to work that much harder to push blood through now tightened arteries that weren't tight before. High heart rate, increased systemic vascular resistance, you have now increased myocardial demand, or a demand for performance, because again, the heart has now got to work harder to push blood through those tightened vessels. You know what else happens? The arteries become more constricted. Oh, and I would be remiss if I didn't say this. Cocaine, especially for those who partake, not just the once, not just the twice, but like this is a regular occurrence with you, it speeds up the process of atherosclerosis, or stiffening of the arteries. And what does that do? That actually increases platelet aggregation and thrombus formation. It increases the propensity towards clot development. Fast heart rate, tight blood vessels, stiff blood vessels, increased risk for clot formation. Do you see how now this is becoming a problem with the arteries that bring blood flow back to the heart and the mismatch in oxygen supply? If the heart rate is sky high, that means the heart is not being afforded time enough to relax, fill with oxygenated blood, and then push that oxygenated blood out into circulation. So now you've got decreased oxygen. You are just gathering the recipe ingredients for a disaster, an absolute disaster. Now, far be it from me as one adult to another to tell you what you can or cannot do with your adult time, your adult money, and your adult situations. That is on you. That is on you. But as a clinician, it is my duty to make sure that your decisions are informed as far as your health is concerned. As an adult, you are free to make whatever decisions you want to make, but you are not free from the consequences of those decisions, not one little bit. And that goes for everybody. Fortunately, this young man, again, 20-something years old, this young man did not suffer any permanent heart damage whatsoever. We did a heart ultrasound. Turned out that everything was okay. But when I tell you that scared the daylights out of him, and I don't think that he's going to participate in this type of activity moving forward. At least that's what he told me. Who knows what'll happen between now and, the rest of his life. Don't know. But I hope that he ends up making very good decisions. Nursing students, this is a brief but informative class that I hope was exceptionally helpful to help you connect the dots. If you are a new face to this classroom, please stick around. Join us. I talk about these things and so much more when it comes to cardiology, because long gone in my classroom, long gone are the days where cardiology is just throwing out a bunch of facts and figures for you to memorize and regurgitate and, remember buzzwords for standardized test taking. I don't do that. I teach for understanding, because understanding takes the fear out of any clinical situation. And when you take the fear out of any clinical situation, you can critically think clearly, which does your patients the best judgment or the best your justice possible that you can give to them. And as clinicians, we owe it to our patients to do them the best justice possible. They trust us with their health. So it's incumbent upon us that we know what we're doing, not because this is what we were told to do, but because we actually understand it. Capiche? Thank you for your time. Class is dismissed.